Jackson. I'm going to be doing the administration of medicine checkoff today. Okay, so the first thing I'm going to do is ensure that there's no distractions. So I'm going to close the medication room door. I'm not going to answer any phone calls. I'm not going to have any conversation with colleagues unless it has something to do with the administration of medicine. And then I'm going to follow my agency's no interruptions of policy. So then the next thing I'm going to do is I'm going to compare my MAR to my patient care order form. So we have Jaguar Jones, 0825, 1963 is the date of birth, 0825, 1963, 41417676 352 352. Next, we're going to move on to heparin, 5,000 units, subcutaneously, every 12 hours. And then allergies is penicillin. And since both these forms match, I'm done using the patient care order form and I can move on to doing the medication. So next I'm going to do hand hygiene. And then I'm going to be picking out the correct medicine. So we're doing heparin, so I will pick up the heparin, 10,000 units per 1 milliliter, expiration date 12/5/2025. So it is still in good use. Okay, now I'm just going to compare it to the order form the MAR one more time. So we have heparin 5,000 units, heparin 10,000 units per 1 milliliter. So that checks out. Now I'm just going to make sure I have the right time. So it is to be taken every 12 hours and it hasn't been taken or given in 12 hours. So it is time to give it. Next, I'm going to be making sure I have the right route. So I'm going to be giving it subcutaneously, which requires me to use the TB syringe. Before I drop the medicine, I'm going to make sure that I have the right calculations. So since this is heparin 10,000 units per 1 milliliter and we're needing 5,000 units, I'm going to use half a milliliter. So I'm going to draw up 0.5 milliliters and I'll have it checked by a nurse if need be. Now we're just going to move on to drawing up the medicine, but first I'm just going to take my alcohol pad and clean off the top of the medicine. Take my needle, empty the cap into the sharps container, pull up my safety, and I'm just going to draw in 0.5 milliliters of air first. Okay, now that I have that, I am going to move on to drawing up the medicine. So we're going to be removing the safety. I'm just going to stab this in. I'm going to inject the air. And then I'm just going to be drawing out 0.5 milliliters, pulling out a little bit more in case I have any air bubbles. Okay, so pull the safety back up. I don't have any air bubbles and it's at 0.5 milliliters. So now I'm just going to check to make sure that I have everything correct. So we have 0.5 milliliters, which is 5,000 units of heparin, 5,000 units of heparin, and then 10,000 units per 1 milliliter of heparin. So that checks out. And then I would just have another nurse check my calculations and what I just drew up. So then after that, I'm going to make my label. And on this label, I'm going to be writing Jaguar Jones, the medications. We have heparin, and we have 5,000 units as the dose, and we're doing 0.5 milliliters. Now that I have my tape done, I'm just going to be attaching it to my needle. And then with this, I can go ahead and make my way to the patient's room. Okay, so once I get in the patient's room, I am going to be performing hand hygiene. And then I'm just going to make sure that I have the right patient by checking the R band. So we have Jaguar Jones, we have 0825 1963, and then we have 0825 1963, MR 41417676 352 352, and then we're gonna check allergies. So we have penicillin and penicillin. And then I would go ahead and ask if you had any other allergies that I need to know about. And then if you didn't, then we would go ahead and move on to the pre-administration assessments, which since we're giving heparin and it is an anticoagulant, which thins out the blood, you would check blood pressure and you would check to see if there's any bleeding anywhere else on the body. And if there's not, then we can move on to our third and final check, which we're going to check the label that we created, which is the compared to the MAR and the vial. So we have heparin 5,000 units, heparin 5,000 units, and it's 0.5 milliliters. And then we have heparin 10,000 units per 1 milliliter. So now if that checks out, we can move on to explaining the procedure to our patient. So today we're just going to be giving you heparin to make sure you don't get any blood clots. From there, then I'm just going to be raising the bed, lowering the side rail, and then we're going to move on to putting on our goggles and gloves. Okay. And I'm going to be giving this medication subcutaneously, which I will be giving it in the abdomen. So what I'm going to do is I'm just going to first start off by cleaning off the area in this way. Circular motion, putting it to the side so I can use it later. Now I'm going to put down my safety, and I'm going to be pinching 2 inches of skin. If I can, then I'm going to do it at a 90-degree angle. If I can only do 1 inch, then I'm going to do it at a 45-degree angle. But since I can, we're going to do 90. Continue to hold the pinch. Now I do not have to aspirate. And that goes into the sharps container. Then I'm just going to apply gentle pressure. Then I'm just going to check to see if there's any allergic reactions. If not, then I'm just going to go ahead and reposition. And I'll take off my gloves. Put them in the trash. Take off my goggles. Then I would raise the side rail, lower the bed, and then I would go and document everything I just did, and then I would come back at the desired time to make sure that he still didn't have an allergic reaction or any other complications to the medication. And with that, we have the medication administration checkoff.